Fantastic. Welcome back to another session at the Black Health Matters Virtual Summit. We're going to talk about access to medicine. And certainly now in the age of COVID, it's been very difficult for people to access their doctors, access their medicine, their protocols. And it's important that many pharmaceutical companies are looking to assist with gaining access to those kinds of products and services. So we are talking about ways in which we can do that in a more efficient and effective way. According to AARP, people are delayed in getting a prescription filled because they didn't have enough money to pay for it. 41% have not gotten their prescription filled because they didn't have enough money to pay for it. And 40% are taking less medicine than their doctors have prescribed to make it last longer because they're afraid to go out to the pharmacies and to their doctors. So we have Niesha Foster, a Vice President of Product Access within the Global Health and Patient Access Division of Pfizer. She represents Pfizer RX Pathways, which is a system enabled to assist with gaining more access to medicines. In this role, she is responsible for U.S. patient assistance programs administered through that Pfizer RX Pathways program. She also leads Pfizer's Multicultural Center of Excellence. Thank you very much, Niesha, for joining us today. Niesha Foster, Vice President at Pfizer. Thank you so very much.
Thank you, Colin. So happy to be here. I remember, I don't know, maybe 6 months ago, Rosalind visiting me in my office at a very different time then. But she said, let's do this. And I said, I'm happy to join. So thank you for having me.
Fantastic.
I will share my screen now. All right, can you see that? All right, excellent. Thank you for joining us here today to learn a little bit more about RX Pathways. At Pfizer, our purpose is clear: breakthroughs that change patients' lives. And we try to achieve that by making sure that we are placing people at the center of everything that we do. And in the United States, it means, in part, helping patients get access to their medicines when they need them. As Colin said, today I'm going to talk to you about Pfizer RX Pathways. It connects eligible patients to various types of support, including offering insurance support, copay assistance, and medicines for free or at a savings. So here's a brief agenda. First, I want to help level set us all and see what the uninsured and underinsured situation has been here in the US, of course, exacerbated by the response to COVID-19, how we help as part of Pfizer RX Pathways, and then I want to take your questions. So first, while progress has been made in helping uninsured patients get access to their medicines, there are still many in the United States who need help. As you can see from this graphic, which we last accessed in 2020 of June, uninsured rates are still quite high. Across all ethnicities and races, about 10% of the US population is uninsured. When you get into the ethnically diverse community, you see those rates are staggering and way higher. American Indian and Alaska Natives are twice as likely to be uninsured. Hispanics, based on this data, 19%, African Americans, 11%. So while progress has been made, more people still need our help. And so you may think that having insurance can be helpful in getting access to your medicines. But what we know from this data is that millions are underinsured. And underinsured means a lot of different things. But generally, what it means is that you have insurance, but the coverage of your medicines that are provided is still not sufficient. More than 1/4 of people with employer plans, that means insurance that you get through your job, and more than 2 in 5 with individual marketplace plans were underinsured in 2018. So to Colin's point, having insurance doesn't necessarily guarantee you access to medicines. And we know from other data that having access to your medicine and taking it as prescribed can lead toward health equity. So at Pfizer, we definitely believe that individuals everywhere deserve access to quality healthcare and the opportunity to lead healthy lives. And in RX Pathways, as I said earlier at the start, it connects eligible patients to a range of offerings: insurance support, copay assistance, and medicines for free at a savings. We have medicine access counselors who will help navigate you through the system so that they can help you determine, based on your unique situation, because we know no situation is alike and situations often change, they will connect you to the program that best meets your needs. So I'll go through these slides and you'll have access to our website. Please always feel free to call upon our access counselors at 1-844-989-7284. So here is a simple four-step process on how you get started. You can either visit our website, www.pfizerrxpathways.com, or call our access counselors at the 1-844-989-7284 number I've already mentioned. And from there, either on the website or the counselor will ask you 4 simple questions. And these 4 questions are to help us determine how to help you and which program you could be eligible for. They'll ask you what Pfizer medicine you've been prescribed. They will want to understand what your prescription coverage is. We talked about uninsured versus underinsured already. They want to know how many people are in your household, and then the total household income before taxes. And again, that helps us to understand for which program you would be eligible. Your results are displayed on your medicine access counselor screen. They will walk you through that. And then based on the program, you will be required to complete a few forms. So one thing I'm really proud of what we've done recently, in addition to the Pfizer RX Pathways website and our medicine access counselors, we really wanted to ensure that from end to end, patients, particularly for our primary care medicines right now, can go apply online and access the status of their account 24 hours a day. So I'll talk to you a bit more about how we've done that via a online platform called Pap Connect, where PAP stands for Patient Assistance Program. And so that website you can access directly at www.pfizerpapconnect.com. Let's learn a bit more. So Pap Connect is a new digital channel for patients and HCPs to apply to the Pfizer Patient Assistance Program. Again, right now, this platform is available for many of our most commonly requested primary care medicines. Patients and HCPs are able to request refills, track their medicine just like you can track your package, and complete enrollment forms and re-enroll in the program. The great thing about this is that access is at your fingertips from your mobile phone, your tablet, your computer. Pfizer Pap Connect. A couple slides ago, I said you answer 4 questions and then results are displayed. And here's kind of the suite of offerings that we have, none of which you need to memorize, but I thought it'd be important so you understand how Pfizer is trying to ensure that we are focused on equity. One program is called the Patient Assistance Program, and that's where patients will receive products for free, depending on their income level and if the product is covered. The next offering is we call the Pfizer Institutional Patient Assistance Program. And so we partner closely with federally qualified health centers, free clinics, disproportionate share hospitals, and their clientele are the uninsured. And for those uninsured patients, we provide in bulk free products at those centers so that if a patient walks in and say, I'm uninsured, I have this Pfizer prescription, can you help me? If the center is part of our institutional patient assistance program, they can do so. Again, another offering for uninsured patients who are paying cash at retail is the Pfizer Savings Program. And so in that program, we offer discounts on our medicines at the retail pharmacy. Specialty and oncology medicines have a unique place in our platform. And here you get individualized support at what we call a patient support hub to walk you through your insurance, to help you understand that, give you, again, access to a suite of these offerings. It could be free drug, it could be copay assistance, it could be a suite of opportunities there depending on what your needs are. And there you get personalized attention. And then lastly, regardless of income, for certain branded medicines, Pfizer also has copay offerings. And I see the questions are popping up, and I will get to them as soon as I'm done the presentation. Thank you. Next up, I talked to you about Pfizer Rx Pathways and the programs we offer. We also try to be a comprehensive resource. On that website, you will be able to identify which of our medicines are available. You'll be able to access the applications. You'll be able to have an overview of these assistance programs and services that I've just shared with you today. You will have access to free educational materials. And then also we'll direct you to information on national and state healthcare resources. Next up, moving out of kind of the Pfizer lens on Pfizer Rx Pathways, we also try to point our patients to valuable industry programs, 3 of which are listed here. The Medicine Access Tool, which is a search engine that allows users to search patient assistance resources, and that's for across all different manufacturers, not just Pfizer. We will also point you to Rx Outreach and Needy Meds. Rx Outreach is a nonprofit charitable organization that provides eligible patients with access to more than 500 medications at an affordable cost. And then we also have Needy Meds, another not-for-profit resource that will help patients locate assistance programs for help with their medications and healthcare costs. So I just want to maybe take a point here and just stress that there are a lot of different offerings to help patients with their medicines. And if you're prescribed something and you can't afford it, it's very important that you do the research that's necessary in order to find out what medicines are available to you and what services to help you pay for them. And so I've been at Pfizer for 17 years, and this is no doubt my most proud role. I get to ensure that those who need us most get access to our medicines here in the US. I get to work with advocacy organizations on health equity issues and so much more. And so I just wanted to share with you, over the last 5 years, from 2015 to 2019, through Pfizer Rx Pathways, we've been able to provide 1.2 million patients in the US, receive 8 million prescriptions for at a savings or for free. And that really warms my heart, and we're really here to help you get access to medicines and support for paying with those medicines. A couple of quotes here from some of the people who have been helped by our program. I'll just read them off. Marjorie said, "It has been the best. I've had a few contacts with medicine access counselors on the phone, and every contact has been very gracious and respectful. And it has always been a positive experience." And Terry shared, "It was just an awesome feeling to know that there was somebody at a company as huge as Pfizer helping a little person here in North Carolina like me." And so I just wanted to leave you with a couple of words, just things to remember. Again, www.pfizerrxpathways.com, www.pfizerpapconnect.com, And we're here to help you. Understanding every situation is unique and situations can change. Always feel free to call upon us if you need help affording your medications. Thank you. Let's see if I can see these questions. Question 1, what kind of discounts can we expect from RX Pathways? So as I said, Pfizer RX Pathways has a number of different options. If you are eligible for a patient assistance program based on your income level and the product that has been prescribed to you by your physician, that product is absolutely for free if you qualify. If you do not qualify for that program and you're uninsured and you're paying cash at retail, we have several levels of discounts for savings at retail. So it could be anywhere from 36 to 75% discount at a retail cost. So it varies. And so the best bet is to call our medicine access counselors at 844-989-7284 to better understand what works for you based on your unique situation. Is the information you are showing mainly for those 19 through 84? I'm thinking maybe that was one of the graphs that I shared earlier. And so let me see if I can go back. That could be, but for RX Pathways, that is not the limit, of course, right? It's based on the prescription that has been written for you. It's based on your income level. I found the page here. So yes, the uninsured data that we provided a couple slides ago was for adults who were ages 19 to 64. Yes. How many people are helped by your PAP and IPAP program? Do I know the percentage that are Black? And so over the last 5 years, we've been able to help over 1 million patients. We do not collect data based on ethnicity. However, as Colin said, we do try to work with community-based organizations. We work with advocacy organizations to ensure that we are making people aware of the program depending on their socioeconomic status. We work with many organizations that are focused on the African American community. All right, next up, is this service only for Pfizer medicines? So yes, Pfizer RX Pathways is only for Pfizer medications. But to my earlier point, I know that many manufacturers across the pharmaceutical industry have programs to make sure that those who can't afford medicines get access to those medicines. Now, there are different criteria, of course, across the various sponsors, as you would expect. But if you have trouble, I highly recommend calling whomever has prescribed your medicine to ensure that you can get some support if needed. Next question up. Can patients with any insurance, including Medicaid and Medicare, receive support from medicines access counselors? Yes, you should call, right? Depending on whether you have commercial or government insurance, the rules will be different. So you should call the access counselors to better understand so they can better understand your profile, your situation, and then they will be able to tell you what offerings are available to you based on your medicine and your situation. Next up, can patients be referred to this service by patient navigators or social workers? Yes, absolutely. So the one thing you must have is a prescription written by your physician, first of all. And then once you have that, it has to be a Pfizer medicine. And then when you call and explain, like I said, answer those 4 questions, we'll be able to let you know whether or not we're able to assist. That question also triggered for me. There are some organizations out there that will charge individuals to apply for a patient assistance program. That is not affiliated with Pfizer at all. So just beware as people are leveraging these various services that there are some who are in this for profit and our offering does not have a charge associated with it to help you navigate our system. And that is the last question so far. I will just give it another second. Some of the data that I provided here is pre-COVID, so I would imagine that there will be many more uninsured patients out there. We have seen within our program, as doctors' offices have been closed, not a lot of new diagnoses. And as a result, we're hopeful that as things safely open up, people will get to their physicians' offices, and if they should need a medication, Pfizer Rx Pathways is here for them. And just one more minute to see if any more questions come through. All right, I think we've given enough time. Well, thank you for joining us here today. These are definitely unprecedented times. We know that it's not over in many ways, and that every individual situation, yes, I can post the contact information again, absolutely. And I am not great at typing and talking at the same time, so I will type this here. www.pfizerrxpathways.com. To all panelists, how do you qualify? So again, it's based on your income level for some of our programs. And so when you are talking to the access counselor or you're entering your information into the website, you'll need to provide the number of people in your household and also your income level before taxes. Earlier this year, we did a public service announcement around Pfizer Rx Pathways. And for individuals making under $50,000, they were eligible for our free program. For families of four making under 100,000, they are eligible for our program. But again, it's important to call the access counselors to understand, so they can understand the full picture of your situation and help determine if the program is right for you. Okay, so we have free products, we have discounts on our products. We're always looking to help you navigate the system so that you can take your medicines as prescribed. We don't want cost to be an option, to be a barrier, excuse me, an obstacle. So feel free to reach out to us at www.pfizerrxpathways.com. Thanks for your time today.